When it comes to students, it's really important for us to know that it's okay and it's safe for us to seek help. In fact, this is encouraged because this can help us get to the bottom of problems before they become so severe that it might even lead to an impairment requiring a mandatory notification.
As a future health practitioner, being a student, it's really important to know about mandatory notifications and any changes to the legislation that occur. I
feel that a lot of us students don't really know that much about the notification process, but it has a very important role in keeping patients safe day to day.
Patients have the right to assume that health practitioners are there to help and not harm, and mandatory notifications are in place to assume that this is happening. There are 4 types of mandatory notifications, which include breach of accepted professional standards, intoxication, impairment and sexual misconduct. As a student, you can only be reported on a mandatory notification of impairment.
As a student, you would rarely be in a situation where a mandatory notification would need to be made about you. The only circumstance is if you have a health impairment that could put a patient at risk, like when you're on a clinical placement.
Mandatory notifications form a small proportion of the notifications that come to AHPRA. You may have heard of them being used in relation to health practitioners. They do apply to students as well, but in a more restrictive set of circumstances than they do to other health practitioners.
You as a student have no obligation to make a mandatory report. That only applies to registered practitioners.
The circumstances in which you could have a report made about you very, very specific and at quite a high threshold.
Some time ago I was asked to see a medical student. Now, this young chap had had a bump on the head, a sort of concussion, and had lost consciousness. So the board were concerned to find out whether there were any cognitive impairments. And in fact, he himself had notified the board, so he was very sensible in doing that, and also very insightful that this could be an issue for him. I assessed him, and on the whole his profile was fine. There were a few little attention problems, but I felt that with rehabilitation he would be able to overcome those. And what he agreed to do was to let the board know, talk to the board about the treatment that he was going to get, and then come back and see me for another assessment. In that situation, there was no need to make a mandatory notification. He actually contacted me about a year later. He returned back to his studies and he had passed, and he was planning for his first job as a doctor.
We aren't so sure where the line is drawn when it comes to this sort of stuff, and it's probably really important for students to know that something like depression or anxiety, it's fine to go seek help for it, and we'd really encourage it to go find help from a GP or another healthcare practitioner. It's so important to get the skill of self-care right while you're a student, because that's something you're going to need throughout your whole career as a practitioner. We have to take care of ourselves before we can really take care of others.
If you're a student experiencing anxiety and depression, please seek help early. Talk to someone. You'll find that it will help you immeasurably, and you are at the start of your journey through the profession. It will help you be a better professional.
As a student and studying for nearly 4 years now, I'm really looking forward to getting out into the workforce and treating patients and doing the best that I can. For more information on mandatory notifications and frequently asked questions, you can visit the AHPRA website.